Good afternoon, and welcome to the Blue Cross Blue Shield of Massachusetts Foundation webinar on Massachusetts Roadmap for Behavioral Health Reform. My name is Caitlin Kenny Walsh, and I am the Vice President of Policy and Research at the Foundation. Before I move into setting some context for today's webinar, I want to acknowledge that today is September 11th, and remember and honor those we lost and whose lives were forever changed on this day. The mission of the Foundation is to ensure equitable access to healthcare for all those in the Commonwealth who are economically, racially, culturally, or socially marginalized. We seek to advance this mission through both policy and research work and grant-making initiatives. We focus our work in three main areas: care and coverage, behavioral health, and structural racism and racial inequities in health. Today's webinar follows the release of a report we collaborated on with Manatt Health to develop an educational resource on Massachusetts Roadmap for Behavioral Health Reform initiative. To stay informed of future Foundation resources, webinars, and events, please make sure to sign up for our emails on our website. The link to do so will appear in the chat shortly. Before we kick off today's webinar, I wanted to offer a little background about the Foundation's earlier work in this space. In the spring of 2018, the Foundation fielded a survey of adults ages 19 to 64 years old, and that survey found that more than half, 55% of a representative sample of insured adults who sought care for mental health and/or substance use disorders had difficulty in obtaining these behavioral health care services over the past year. These data were reinforced by many other data sources and personal experiences of people struggling to gain access to care for themselves or a family member. In response, in an effort to inform solutions, in early 2019, the Foundation issued a report in collaboration with Manatt Health entitled Ready for Reform: Behavioral Healthcare in Massachusetts. This report included the development of a conceptual model for a new behavioral healthcare system that aimed to address many of the access challenges experienced in Massachusetts and highlighted the gaps between the then current system and the model system. Among many other key inputs, this report and the conceptual model it included helped to inform the development of the state's behavioral health roadmap. The webinar today includes an overview of the roadmap for behavioral health reform. It features a discussion of the goals and key components of the roadmap, and it provides an update on early implementation experience. It is intended to help stakeholders better understand the roadmap and its initial successes and challenges in implementation. Before we begin, I want to quickly go over a few housekeeping items. We are using the mute feature on the audio line during the webinar to reduce background noises. We encourage your participation, and we will be taking questions at the end of the presentation via the Q&A feature. To submit a question, please click on the Q&A icon located at the bottom of the Zoom window. We will try to answer as many questions as we can at the end of the webinar. This webinar is being recorded. In the next few days, we will post a link to the recording and a copy of the webinar slides on our website. I want to introduce the speakers for today's webinar. In addition to myself, we'll be hearing from Jocelyn Geyer, a Senior Managing Director at Manatt, and Stephanie Anthony, a Senior Advisor at Manatt. Jocelyn, Stephanie, and their colleagues, Elizabeth Boyes and Natasha Rosario, are the authors of the recently released report on the roadmap, from which the information for this webinar is drawn. I also want to acknowledge the immense contributions of my colleague, Jessie Gott-Sagan, on this project. So, what can you expect in today's webinar? After I finish this welcome, I'll be handing the webinar over to Jocelyn and Stephanie, whose presentation is divided into three main sections. They will start with a brief overview of the goals of the roadmap and its key components. Second, they will cover the learnings on early successes and challenges with implementation. Third, they will summarize some specific opportunities to strengthen roadmap implementation moving forward. We'll then stop and take some time to answer your questions on this topic. Finally, we'll wrap up by summarizing today's key findings. Before I kick it over to Jocelyn, there's one last thing we need to do. We will be giving you a survey question to test your familiarity with the roadmap. And then we'll ask you to complete the same survey question at the end of the webinar. Your answers will help us determine whether we've effectively conveyed some key pieces of information about the roadmap in Massachusetts. This is really a test of us, not of you. Let's start with one of those questions now. The question will pop up on your screen with multiple choice answers. Please choose your answer and submit it. Looks like many of you are already further along in this. So I'd just like you to answer the question, overall, how familiar are you with the Massachusetts Roadmap for Behavioral Health Reform? I see many responses coming in. Don't worry, your responses are all anonymous. I'm going to let this stay up for a minute, but please indicate if you are not at all familiar, slightly familiar, somewhat familiar, moderately familiar, or extremely familiar with the Massachusetts Roadmap for Behavioral Health Reform. It looks like our responses have slowed, so I think we can conclude our poll. I really want to thank you for your willingness to answer our question, and I will hand it over to Jocelyn now.
Great. Thank you so much, Caitlin. And we're going to walk through and start with an overview of the roadmap. And as Caitlin said, then go deeper into each element and share some of what we learned. So let's go to the next slide. Next one. So the roadmap is a strategy. It's a framework for how to address some key issues identified by Massachusetts stakeholders over a multi-year process that we'll describe in a little bit. So we're going to, throughout this webinar, be talking about specific components and programs and initiatives. But at a high level, the roadmap is really about Massachusetts' plan moving forward for increasing access to culturally relevant behavioral health care for all residents. And that's really important. It's a payer agnostic plan. It is not just for folks who have public health insurance coverage, not just for folks who have private. So it is truly a comprehensive framework for all Massachusetts residents. And it grows out of what I think are issues that are in Massachusetts and around the country, which is the struggle that people in Massachusetts have reported finding providers that will see them. Caitlin alluded to that, very alarming data in her intro, who will take their insurance and who can, even once you can get in and see someone, are they giving you the appropriate culturally competent care that you need? A lack of integrated mental health and substance use treatment, long siloed, even though in the lives of families and individuals, they're integrally connected. So the roadmap has a framework for responding to that lack of integration. And then, as you'll see, as we talk through the specific programs and initiatives, it grows out of a deep concern that all too often people end up having to go to emergency departments when they're in a mental health crisis, even if they could potentially be stabilized in the community, or better yet, avert landing in a crisis situation because they've been able to access appropriate care. So that's the framework. If we can go to the next slide. There's a couple core elements and pieces of the puzzle that Massachusetts is putting in place as part of this framework. And Stephanie's going to come back and go into them in detail, but we wanted to give you a big picture overview so you can see a little bit how all these pieces fit together. So perhaps just to start, a key piece is a new-ish behavioral health helpline, BHHL, that was set up so that there's a single place that people in Massachusetts can call when they need clinical help figuring out what's going on with their situation and where they should be going for resources. So there's lots of other hotlines and help out there, and we're going to talk a little bit about how they fit together. We've got 988 for crisis, but the behavioral health helpline is really responding to that deep problem that people are often lost and don't know where to go. So this is an extraordinary front door that Massachusetts is building for its residents so that they can have a single place to call and walk through that door. It, however, is not the only door. A key part of the roadmap is building out community behavioral health centers, which are charged with delivering care on site in a timely way to folks and across that full continuum of care. So crisis services, but also outpatient and ongoing support for folks. I will note it's essentially a new provider designation, but with that provider designation is all sorts of requirements that are aimed at creating that whole person-centered care for folks, including, importantly, adults and young people and children and their families, so not limited to a particular population. Behavioral health urgent care sites are there to provide outpatient access to a limited set of behavioral health care services for urgent needs. So really responding to that, those folks who have an urgent need, it can't wait. They're not looking for, I need, a therapist 2 or 3 months from now. They're not in immediate crisis, but they are in an urgent situation and require that support. And those behavioral health urgent care sites operate out of community mental health centers. And then finally, we're also going to be talking about, because the roadmap, as I mentioned, trying to avert those crises, has a large focus on integrating into primary care behavioral health supports for people. And Massachusetts has a very innovative, states around the country are watching it, approach to primary care, where its accountable care organizations are charged with setting up different tiers of primary care, with the highest tiers really hitting the mark in terms of providing integrated behavioral health. Okay, let's go to the next slide. So those are some of the core elements, just to tell a little bit more about kind of where we are, because part of what we wanted to do with this report and the work with the foundation is to what's going on? I mean, the roadmap has been around. It started with statewide listening sessions in 2019 that informed the development of the design of the roadmap between 2021 and 2022. And then things really got started on implementation in early 2023, but it's still mid-step on implementation. And that's part of what we'll be talking about. Is kind of where are we in the process of setting up this roadmap? I think the other thing before I turn it over to Stephanie that I would lift up is it is intended to be a living document. It was not written to just either sit on a shelf or to be the final blueprints. It is designed to be an iterative strategy and framework, which is part of why we felt it was important to do this update and continue that conversation about what's happening with the roadmap and frankly, where it needs to go next to meet those foundational needs of Massachusetts residents. Okay, next slide. And I'm going to turn it over to Stephanie, who's going to dive in on some of those core elements and what we're hearing about them.
Great, thank you, Jocelyn. So you can go to the next slide actually, and I'll stop for a second here. So I'm going to provide a more detail on each of the roadmap components that Jocelyn just described, provide an implementation update, including early successes and challenges that were based on perspectives we heard through interviews with some key stakeholders in Massachusetts, including state officials, community behavioral health providers, consumer advocacy groups, and other behavioral health experts, and based on a review of existing literature and some early data on the roadmap. As Jocelyn noted, the roadmap's design was informed by a broad array of stakeholders through public listening sessions and through various stakeholder forums and public presentations put on by state agency staff. Based on that input, several state agencies and key partners worked together to design, implement, and now oversee the roadmap, including the Department of Mental Health, the Department of Public Health and Mass Health, all within the Executive Office of Health and Human Services, the Division of Insurance, and the Massachusetts Behavioral Health Partnership, among other partners. The overarching takeaway from our research is that stakeholders broadly support the roadmap's vision and goals and applaud its timely rollout and the state's cross-agency and ongoing commitment to implementing the roadmap. Stakeholders did identify some important opportunities to strengthen the roadmap as it continues to be implemented. As Jocelyn said, this is a living document, a living framework, a living multi-year strategy. So operationally and with respect to its oversight, stakeholders did identify some opportunities so that the state and its partners are able to successfully achieve the roadmap's vision and goals. I'm going to cover the operational implications in the coming slides on each roadmap component, but from an administrative perspective, stakeholders identified opportunities to continue to strengthen cross-agency communication and coordination on roadmap implementation and ongoing oversight, and to ensure that there is an ongoing continuous stakeholder engagement, consultation, and feedback loop and forums that include a broad array of stakeholders. And Jocelyn's going to talk a little bit more about those later. You can go to the next slide. So in terms of the Behavioral Health Helpline, that's where we're going to start, the BHHL. The Behavioral Health Helpline is a 24-hour a day, 7-day a week, 365-day per year, free entry point to Massachusetts behavioral health system for all Massachusetts residents, regardless of insurance coverage, so they can be connected to both mental health and substance use disorder treatment and services, or both. Trained staff at the BHHL, including clinicians and peer specialists who are people with lived experience in mental health and substance use disorders, screen people who call or chat or text to the BHHL. They identify appropriate services using a clinical assessment tool and make referrals to those services. And then they provide warm handoffs or seamless connections to those resources in a timely manner. BHHL staff follow up with people within 48 hours for handoffs to crisis services and within 14 days for outpatient referrals to ensure those connections are made. The helpline also provides interpretation services in roughly 200 languages. As part of their work to make sure people get to the right resources, helpline staff may refer callers to other appropriate helplines. I saw a question on this actually in the question. We can get into more detail on this later. But they do refer people to other appropriate helplines, such as the National 988 Suicide and Crisis Lifeline for callers who may need immediate emotional support, or to the Massachusetts Substance Use Helpline for callers with SUD needs. They may transfer people to 911 in situations where there's a medical emergency, an immediate risk to the caller or others, or if the caller asks to be connected to 911. BHHL staff is also trained to refer callers to Mass 211 for non-behavioral health related needs, such as housing or emergency shelter, food security, and more. The Department of Mental Health oversees the BHHL and has contracted with the Massachusetts Behavioral Health Partnership to operate the helpline. Together, they maintain and update on a quarterly basis a public-facing BHHL dashboard to show progress and trends in BHHL utilization. You can go to the next slide. A key success of the helpline to date is that stakeholders feel it was implemented relatively smoothly and is effectively connecting residents to behavioral health care services based on their needs. Stakeholders attributed this to the Department of Mental Health's tight collaboration and coordination with stakeholders on the design of the BHHL, and then with the partnership, the Mass Behavioral Health Partnership, again, the vendor chosen to operate the BHHL, on its implementation, oversight, and monitoring. According to the BHHL dashboard, in 2023, the helpline handled over 42,000 calls in under 2 minutes, with the average wait time being 56 seconds and the average call being 21 minutes. The helpline also handled over 13,000 texts and chats to the helpline, which saw highest use of those functions from teens and young adults, so critically important features for connections. And across all communication methods, people were provided warm handoffs to outpatient mental health services, about 45% of the people who contacted the helpline, to urgent care for 17% of contactors, to mobile crisis intervention services for 7%, emergency care for 3%, and other services 18%. In terms of challenges, stakeholders mostly noted the need for increased education and awareness among the public about the helpline and when to call it versus other helplines, or calling providers such as community behavioral health centers directly. According to stakeholders, this need for clarity of roles and responsibilities across resources initially contributed to some people getting bumped around to different resources in the referral process, but these glitches seem to have started to smooth out over time as workflows and education and awareness has improved. You can go to the next slide. So the roadmap also created community behavioral health centers, or CBHCs, to expand statewide access to a broad array of community-based behavioral health services, including for people in crisis, as an alternative to hospital emergency department utilization. CBHC community behavioral health center services include crisis services, urgent care services, routine behavioral health services, care coordination, peer support services, and coordination with primary care to adults and youth with mental health and/or substance use disorder needs. CBHCs must also provide same or next day evaluations and assessment and must be open for extended weekday and weekend hours. A critical and core function of community-based, the CBHCs is to provide crisis services in the community for both adults and for children and youth, actually through separate crisis programs for adults and for children and youth. These services help reduce avoidable use of the emergency department. They prevent inpatient or can prevent inpatient hospitalizations and help reduce ED boarding, which is when individuals are held in a hospital ED while waiting for the availability of an admission to an inpatient hospital bed. Crisis services provided by CBHCs include mobile crisis intervention or MCI teams that respond to crisis situations in the community, including in homes and in schools, or on site at the CBHC by conducting crisis assessments and providing crisis de-escalation services. The other main crisis service that CBHC provides is Community Crisis Stabilization, or CCS. CCS provides short-term overnight crisis care along with therapy, medication management, and other services, including future crisis planning. CCS, Community Crisis Stabilization, can be co-located at the CBHC, and currently 20 CBHCs have adult CCS on site and 5 have youth CCS on site, or CBHCs can contract with local community-based CCS providers to deliver those services. As noted above, CBHCs also provide an array of non-crisis services such as individual and group therapy, medication for addiction treatment, peer supports, and other services. While MCI, Mobile Crisis Intervention Teams, are covered for all individuals regardless of insurance, the coverage and payment structures for community crisis stabilization and non-crisis services at CBHCs can vary across payers and within payers across plans. Jocelyn's going to talk a little bit more later about insurance coverage for roadmap services, including CBHC services, so I won't go into a lot of detail on that here. You can go to the next slide. You can switch the slide. Yeah, there you go. A year and a half in to implementation of the roadmap, which again started in January of 2023, CBHCs are up and running with 27 community-based health centers, some with more than one location operating statewide. They are thriving in some areas and still working out some kinks in others, according to the stakeholders' perspectives that we talked with. In terms of successes, due in part to a bundled payment structure for Mass Health for some or most non-crisis services that CBHCs provide, it provides the CBHCs, according to stakeholders, with some operational and staffing flexibility, such as the ability to create a team-based environment. The CBHCs, because of this flexibility, operational and staffing flexibility, they've been able to attract and retain a robust workforce, according to many, which on the flip side may be inadvertently diverting clinicians from other care settings. Again, this is according to feedback from the field that we talked with. CBHCs also report an increasing number of people going to the CBHCs for care instead of emergency departments, which is part of the goal, including some for community-based admissions directly to an inpatient psych bed, so avoiding the ED altogether. We also learned of some innovative models emerging through CBHC partnerships with emergency departments and with law enforcement to really start to shift the norm of people using EDs for crisis care to people using and then establishing ongoing relationships with CBHCs to receive care in the community. Some examples with respect to the ED, some CBHCs have staff embedded in EDs for high utilizers. In terms of law enforcement, there are some ride-along programs where CBHC staff that are trained in crisis de-escalation ride along with law enforcement, and I think we're going to talk a little bit more about those too. However, these issues around transportation to community-based health centers by emergency responders, both ambulances and law enforcement, continue to be a challenge, according to many. There seems to be some confusion on the regulatory authority for ambulance drop-offs at community-based health centers, and potentially some liability concerns among law enforcement if a person may also need emergency care. So those are some, early challenges we've heard to date. Other challenges cited included the ability for CBHCs to staff separate adult and then youth and children crisis programs, and the varying insurance coverage that I mentioned earlier for some CBHC services, which could inhibit access to some people to timely outpatient treatment provided by CBHCs. You can go to the next slide. So similar to physical health urgent care centers, the roadmap created behavioral health urgent care centers, or BHUCs, or BHUC sites or locations. Behavioral health urgent care offers same day or next day outpatient appointments for urgent behavioral health care needs and extended weekday and weekend hours. EOHHS defines urgent care behavioral health needs as characterized by changes in behavior or thinking, enroll dysfunction, emerging intent of self-injury or threats to others, but do not include immediate risk of harm to self or others, and do not include emergencies, as Jocelyn mentioned earlier. Therefore, the behavioral health urgent cares do offer more limited services than CBHCs and do not offer crisis intervention services. But they do offer screening, treatment, and triage for urgent behavioral health needs, psychopharmacology appointments, and follow-up appointments, among other services. BUHCs currently operate, as Jocelyn mentioned, within the Commonwealth's existing community mental health centers. And so some BUHCs may have age restrictions that align with those of the population served by the existing underlying entity. So some have age restrictions that will serve people 18 and over, or 13 and over, or 4 and over, again, depending on that community mental health site. There currently are 61 behavioral health urgent care sites statewide, given their co-location requirements within the community mental health centers, compared to the current 27 CBHCs. Early feedback from stakeholders on the behavioral health urgent care sites include that some of the community mental health centers have struggled to meet the staffing levels necessary to offer extended hours or other implementation requirements. I'll note here that the state is actively working on ways to better support BUHC implementation, including through increased grant funding to the mental health centers to establish BUHC sites. That increased public awareness and education about behavioral health urgent care services, particularly in comparison to community-based community behavioral health centers, and increased coverage of BUHC services are needed to increase utilization of these sites and services. And finally, another early feedback from stakeholders is that some of the underlying community mental health centers in which the urgent care sites are located may face financial sustainability issues of their own, posing potentially risk for long-term sustainability of the behavioral health urgent cares. You can go to the next slide, please. The final two core components of the roadmap are still in their early stages of implementation, so there was less data and stakeholder feedback on those components. These include integrated behavioral health and primary care, and improving member experience and treatment options for crisis and acute care. So I'll take one at a time. Through integrated primary care, the state aims to expand access to behavioral health services and resources that are identified and managed in primary care settings, with a primary focus on primary care physician or PCP practices participating in the MassHealth ACO. So currently, the Integrated Primary Care Initiative is focused in the MassHealth program, but that will change over time, or may change over time. To do this, MassHealth has established a primary care physician sub-capitation payment model in which enhanced payments to primary care practices are tiered, with higher payment tiers tied to increased integrated care delivery, staffing, and other requirements. So to qualify for higher tier and these higher integrated care primary care payments, PCPs primary care physicians and practices must meet certain standards for behavioral health integration, be able to manage mild to moderate behavioral health care needs, and provide on-site access to certain behavioral health treatment, such as and including medications for opioid use disorder. The two main pieces of feedback we received on this component of the roadmap are that the PCP practices would benefit from some practice standards and other guidelines for meeting the various integration requirements and standards, and that something I mentioned earlier, that the behavioral health primary care integration practice models and payment incentives that exist in MassHealth, which is the main focus of the roadmap component, and across commercial payers where similar types of programs or model exist, can be inconsistent, both with MassHealth and with each other. So this can create confusion or gaps in access to timely behavioral health screening, interventions, and referrals for many, particularly commercially insured individuals. You can go to the next slide. So the final core component of the roadmap is a cross-cutting effort that works in concert with the others to streamline and expand access to behavioral healthcare services across the care continuum, including community-based crisis and acute care services. And this is all to improve member experience and treatment options for crisis and acute care while reducing unnecessary emergency department visits. Consumers still frequently default to seeking care in EDs rather than community-based health centers for several reasons, including lack of education and awareness about community-based alternatives, workforce shortages in the crisis intervention services, the MCI and CCS I described earlier, and lack of transportation options for moving a person from the ED to community-based diversionary care. ED boarding remains a particular issue for children and youth that was raised by stakeholders. According to stakeholders, this is examples. Children and youth who are part of the child welfare system often continue to be seen in EDs because they may not have placement or treatment options available when they're in crisis, a foster home or a residential care bed. Some families may feel it is unsafe to bring a child home when the ED staff believes they're ready for discharge. So there's still some challenges around ED boarding, particularly for children and youth. Mass Health has taken several actions to support emergency department diversion, both in partnership with emergency departments and through requirements on managed care entities that participate in Mass Health, such as requiring EDs to conduct crisis evaluations and warm handoffs upon a person's discharge to the community, and requiring managed care entities to cover behavioral health crisis evaluations and crisis management services after a member is admitted to a medical setting. According to stakeholders, more needs to be done, however, to expand alternatives to the ED for individuals in need of crisis or acute behavioral health care services. And they focused specifically on three things: a more ambitious expansion of community-based crisis services, both for children and adults, expansion of inpatient psych beds, and expansion of 24-hour addiction treatment for adults. So with that, in that overview and description of the roadmap components, implementation update and early successes and challenges, I'm going to turn it to Jocelyn for a view on looking ahead.
Great. Thanks so much, Stephanie. Let's go to the next slide. So and one more. We wanted to leave you with some of the thinking and insights from stakeholders and others we spoke with about next steps that would continue to strengthen the roadmap. And I'll just say right off the bat, for those of you that work in the clinical space and do dialectical behavioral therapy, I feel a little bit like a DBT practitioner in the sense that at the heart of that is the idea that you can be doing the absolute best you can, be doing a great job, and there's still more that you can do. So view this as lots of amazing work underway in Massachusetts, and these are thoughts and ideas for continuing that improvement and strengthening things. So, and to start with that, we've heard a lot about the work underway across the many, many agencies that have to be front and center in the roadmap: Mass Health, Department of Mental Health, Public Safety and Security, because they oversee ambulances, Department of Insurance, because they oversee the private commercial plans, and all of these folks have been coming together. And we heard that there is still a need for more and stronger cross-agency collaboration and communication. And folks lifted up that there are some strong vehicles out there for potentially accomplishing that, including the Office of Behavioral Health Promotion within EOHHS, which was created very much with this purpose of facilitating interagency project and work, and also has the advantage of being strongly oriented to addressing equity issues, which come up across the country and certainly in Massachusetts as it does its roadmap work. I think on a related note, and you can see it some in the comments and the questions, a call for a comprehensive implementation dashboard update so that it's possible for stakeholders, families, even cross agencies to understand where things are with the roadmap, and then what's the concrete data that tells us how we're doing, and pulling that together so that it's possible to see. And I can see the questions on like, what is going on with ED visits, which are down? What is going on with how frequently people land in the ED who could have been averted? So a strong call for that cross-agency collaboration and that creation of a solidified single source of key information and data, really a data dashboard, implementation dashboard would be extremely helpful. The other thing we heard, and again, heard lots of just an outpouring of positive feedback about the work that was done to engage with stakeholders to develop the roadmap, to set up things like the behavioral health helpline, and a sense that even more would again make this stronger. And so just to get a little more specific, a sense that a lot of the conversations that are underway and that happen can sometimes be a little bit more information reporting as opposed to a structured two-way conversation about the status of the roadmap and what needs to happen next for folks. So to think about setting up a structured feedback loop specifically focused on the roadmap was one of the key recommendations that came out of the conversations with the many stakeholders around the state. I think the other thing that harkens back to some of Stephanie's descriptions of what's happening with the behavioral health helpline and the other lines out there, a sense that it would be incredibly helpful to have an even stronger public campaign to help people figure out when they call which line. The behavioral health helpline is out there as that key front door, and yet when you talk to family-led organizations, consumer-led organizations, even though that message is written on websites, it's written in flyers, there's still confusion out there about where to call and when. And given the very strong structure that Massachusetts has set up, there's an opportunity with a public awareness campaign that continues that conversation, continues that almost retraining of all of us to figure out where to go and how to seek assistance for behavioral health would be extremely helpful. Stephanie alluded to front and center in this roadmap is trying to help people get care and support in places other than EDs. And we're hitting lots of transportation challenges. So as she mentioned, it's a combination of ambulance providers feeling uncomfortable, and we'll talk in a second, potentially feeling like they do not have the legal sanction to go ahead and bring someone to a CCBHC rather than an emergency department, as well as concerns from law enforcement that they're not sure it would be as safe to bring someone to a CCBHC as it would be to bring them to the emergency department, plus a very practical concern that they sometimes may have to drive a further distance, and law enforcement obviously have lots of demands on their time. So I think I certainly heard requests for help with those issues, including helping ambulance providers sort through, and it sounds like there's work on this underway, when they can bring someone to the ED, and the Department of Public Safety oversees ambulance providers, and they are working with them now to help them figure out how to get plans in place that will then make it viable and legal for them to bring people to CCBHCs. So concrete things that could happen there. And in some ways, this conversation brings it back up to the first recommendation we heard, which is the need for that cross-agency collaboration. So it's a really good example of where even more intensive work between public safety and the behavioral health agencies could help facilitate and ease some of those concerns that are making it difficult to transport folks to CCBHCs rather than EDs. And then we wanted to spend a little bit of time, because we can see it coming up in the chat, lots of focus on where are the commercial payers on this? Mass Health, DMH, lots of folks doing lots to make things run. Massachusetts, as Stephanie outlined, does have some requirements that commercial payers do pay some of this, but as we'll talk about, if we can go to the next slide, there are some gaps in it that next steps and next iterations of the roadmap may want to address. So what you'll see on this slide is we took kind of the key components of the roadmap, the behavioral health helpline, the CBHCs, and the behavioral health urgent care centers, and then looked at by payer source, how close are we getting to that payer agnostic vision where everyone, regardless of insurance, can access these services. If you have Medicaid, you're good. Straight down the line, MassHealth is covering the full array of roadmap services. If you have Medicare coverage or commercial, it starts to get a little more complicated. Medicare is accepted by CBHCs, but, and someone put this in the chat, the reimbursement rates may not be akin to that bundled payment that Stephanie talked about that has been so important in the progress of CBHCs. And to the extent Medicare is not paying for the crisis services, it is in fact Massachusetts dollars, which are raised through a surcharge on commercial plans that is subsidizing and paying for that. In terms of Medicare coverage at BHUCs, that urgent care depends. So it can be varied depending on the site and whether or not it accepts Medicare. So we've got some gaps there to look at. In terms of the commercial coverage, and we lift Massachusetts up all the time around the country, you are further along in expecting and looking to your commercial plans to pay for crisis services. And so there are provisions and laws, and the Department of Insurance put out a very helpful explanation of them in 2023 that explains that plans are required to cover mobile crisis intervention services. But there's always a but on this for now that we want to look at. But they have discretion over reimbursement rates. And so again, there's questions as to whether or not the reimbursement is sufficient or if private plans are letting the public system essentially do much of the work on the payment and reimbursement. And then a much larger issue that is true everywhere is Massachusetts does not have authority over large self-insured plans, which are regulated by the federal government. And so there's limits on what you can expect them to pay for, do, and those kinds of things. In terms of the behavioral health urgent care, varies based on the particular plan and their decision about whether or not to participate. So again, some gaps in that space. And then for now, in terms of the uninsured, it is Massachusetts dollars coming in and helping to support that effort. So as you stand back and look at this chart, you can see biggest gaps in the commercial coverage space and in the Medicare coverage space. And so an area for further work. Okay, I think we're gonna do one more slide and then close out for comments and questions, but if we can go to the last one. Couple other key themes, each of which could be a deep dive. So encourage you to look at the material in the report. Underlying all of this is a sense of the need to continue to strengthen the behavioral healthcare workforce and to really address some of those issues that Stephanie has flagged, where the robust reimbursement for CBHC is maybe somewhat inadvertently shifting around staff and behavioral health clinicians who would be serving other individuals. And so really needing to look at whether additional payment reforms are needed outside of the CCBHCs so that there's not this swoosh towards the CCBHCs. So other investments that are possible as well. We continue to hear that data sharing and understanding what's going on with individuals and being able to share information across systems and providers is a challenge. It's a challenge everywhere. Here, I don't think we're going to solve this one just at the Massachusetts level. There's some national gaps, but did want to lift up that there are some states out there that have figured out some creative ways to get some resources to help build out the electronic health records and the interoperability of their behavioral health providers that may be promising in future iterations of the roadmap. And then finally, I want to close out with a focus on some of those equity concerns and issues that we heard across the board from stakeholders, that there's much more work that needs to be done to really address disparities by community and who's able to access services. and a particular flag that the experience of engaging with law enforcement can be variable on any given day. And certainly for some communities, Black and Latino and other people of color may have a very different experience with law enforcement, making it imperative to take a really close look at referral patterns. And as we're working together to shift away from law enforcement and ambulance as the vehicle for connecting people to care, really understanding and working at how to change that experience for historically marginalized communities in particular. Okay, so I think I'm going to turn it, if we can go to the next slide. Caitlin, I'm going to turn it back over to you.
Thank you. Many thanks to both Jocelyn and Stephanie for covering this content in what I hope is an accessible way for all of you. We had a number of questions come in, some of which I think we've answered through the chat, others of which I'd love to ask each of you to try and help us respond to. We're going to get through a number of questions, and then I do want to leave a little bit of time at the end to wrap us up, remind us of what we've covered today, and of course, ask you 2 more poll questions. So the first question, Stephanie, I think is for you. One of the questions is, will the BHHL integrate with 211 and 988? I'm wondering if you could respond to that question.
Sure. My understanding, the state may have things in the works, but is that there, 988 is a national hotline, helpline, where 211 is a state specific with other counterparts. Where the BHHL helpline is obviously mass specific. So while right now, I don't think there are plans to technologically integrate, systematically or systemically, but, as I mentioned, there is an enormous amount of training, coordination, collaboration across the different helplines. And one thing I think that's going to, again, help with some of that clarity of roles and responsibilities to help with that seamless integration, even if it's not technological integration, is the education and awareness about where to call for appropriate services and, continued improvement of the workflows across. I don't know, Jocelyn, if you know different about any plan to technically integrate the helplines, but I think it's not there yet.
I'm gonna move to another question. This one, Jocelyn, I'm gonna send your way, although Stephanie, certainly feel free to chime in. This question says, Mass Health and the MCOs pay a higher rate to behavioral health urgent care providers. Commercial insurers do not. Are behavioral health urgent care providers required to meet the BHUC standards for all members or just members of the Mass Health plans? This matters when referrals come in through the BHHL.
Yeah, so I think this question goes in part to the last discussion we were having, which is commercial plans are not necessarily obligated to contract, much less to reimburse at specified rates, although some do. So it speaks to the importance of working with them and continuing to work on that effort. My understanding, but would want to verify, is that the standards apply to the facility, so to behavioral health urgent care centers, and are not dependent on your insurance status. So would expect that if commercial plans are paying, part of what they're paying for is that set of services to the standards that have been identified by the Commonwealth.
Thanks, Jocelyn. Really helpful. And we'll just harken back to your comments. Both the content in the prior slide that lays out coverage by component by insurer is probably helpful in this question, and that's also augmented in the context of the report we released. I want to toss a question back to you, Stephanie. One of the questions that popped up is, what is the relationship between community behavioral health centers and community mental health centers? Could you talk a little bit about that?
Sure. Yes, Massachusetts has a lot of acronyms and similar sounding things, but they are different. Community behavioral health centers, again, are part of the roadmap strategy and creation, really just being implemented starting in January 2023, where the community mental health centers have pre-existed and been around longer. The CBHCs, the Community Behavioral Health Centers, really are a one-stop shop, or intended to be a one-stop shop for all community-based behavioral health centers, both mental health, substance use disorder, including, again, crisis services, where the community mental health centers, again, had predating the CBHCs, are really tailored and have been historically tailored to people seeking treatment for mental health disorders, although a person could present and use a community mental health center that has a co-occurring SUD need. And they're at the community mental health service is really provided care by a team under the medical supervision of a psychiatrist. So they're slightly different, slightly different organizations, slightly different types of services, with the CMHCs more tailored to people with mental health and care under the direct supervision of a psychiatrist.
Thank you, Stephanie. I think this may be maybe this question and then one more before we turn to wrapping things up. So Jocelyn, this question is for you. How does someone in need of behavioral health services determine which entry point is the right point for them? We talked a lot about integrated entry points into the system, and I'm wondering if you can talk a little bit about how someone who needs services figures out what the best approach is for them.
So very practically, the behavioral health helpline is designed to serve that function. If you're not quite sure where to go, they have clinical staff who will do an assessment to figure out what you need. So just practically, if I were giving advice to friends who live in Massachusetts, that's where I would start. That said, I think what you heard in this conversation is some feedback that there remains some confusion about where to go and the importance of continuing a public education campaign to help people. Because I think we all know at the end of the day, if you're in a mental health or substance use situation, you often lack the language to even understand and articulate what the services are that you need. And so the behavioral health helpline is designed to respond to that and help that, but we need to do more to help people figure out that that's a key place to go.
Thank you, Jocelyn. One last question. Stephanie, I'm going to turn this one over to you. The question is, will there be a process to add additional sites or agencies to the CBHC system? I think this question is coming from a place of recognizing that, geographically, we may have differences in terms of access to CBHC sites, and it points out that there's only one site in the Berkshires and western most part of the neighboring counties. So I wonder if you could speak to that, whether there will be a process to add additional sites to the CBHC system.
Sure. My understanding that there is and will be a process for growing CBHCs, particularly in areas where they don't exist. As I mentioned, there's 27 now with sites, some having more than one location, but that number has grown, not, including within the past several months. Like, it's growing definitely since January of 2023, when this first started to be implemented, and including even, recently in the past few months. So I don't have the details at the moment on the exact process or timeline, but I do believe that the intent is to continue to expand the CBHCs, particularly in areas where there are access gaps and geographic service areas not served by CBHCs, to provide those services.
Thanks to all of you for your thoughtful questions, and thank you to Stephanie and Jocelyn for your thoughtful answers. Just in the interest of ensuring we wrap on time, I'm going to take a few minutes now to do some key takeaways from today's webinar, and then to pivot to some of our survey polls and questions. So if you don't mind turning to the next slide. Today, we looked at the goals of the roadmap for behavioral health reform. We identified its core components aimed at increasing access to culturally relevant behavioral healthcare services for all residents. These include streamlined access to a broader set of behavioral healthcare services across the care continuum, including in particular community-based crisis and acute care services. The components also include an array of new integrated entry points, just as Jocelyn was speaking to, for access and referral to the right services. Those include, we talked about the development of the state's behavioral health helpline, which allows screening and warm handoffs to the appropriate level of care and services. It includes community behavioral health centers, of which there are now 27 in Massachusetts, that provide on-site services including same or next day evaluations and assessments, and which are open for extended weekday and weekend hours. And also behavioral health urgent care sites, of which there are now 61 across the Commonwealth that are also open for extended weekday and weekend hours to provide treatment for urgent behavioral health care needs. And integrated primary care. This component of the roadmap, which will be a greater focus for future implementation, aims to bring access to behavioral healthcare services to Mass Health members enrolled in accountable care organizations through their primary care provider site. So really in an effort to help address needs right through primary care and minimize escalation. Our research found that the roadmap is an essential part of the vision to create a robust continuum of behavioral healthcare services for all Massachusetts residents, regardless of their insurance coverage. And at this early implementation stage, there have been some clear successes that were identified and discussed today in improving access to care for behavioral healthcare services in the community. At the same time, because there is always a complement, we found there is room for strengthening the system, particularly related to the continued rollout of all components of the roadmap and with respect to developing a system for ongoing monitoring and continuous improvements. So as Jocelyn was saying, the roadmap can really fully move forward in accomplishing its vision. Before we go, we'd like to ask you to participate in 2 more surveys. First, we'd like to see how well we did in imparting this information. So please take a few seconds to answer this question, which I see coming on our screen, again, so we can understand how your knowledge has improved. So the question is, overall, how familiar are you with the Massachusetts Roadmap for Behavioral Health Reform? I see responses coming in. I would ask you to provide an answer ranging from not at all familiar to extremely familiar. Please choose the choice that best aligns with your familiarity. Looks like our responses are still coming in, so I'll give it another few seconds. I think we can probably wrap at this point. Thank you. I'd like to take a moment to ask you another question. And this time, our goal is really to get your input to inform our future work related to the roadmap. And so here, I'd like to ask you to tell us what roadmap components would you like to learn more about, either through a one-pager or a deeper dive issue brief or an additional webinar? Would you be interested in learning more about the Behavioral Health Helpline, about community behavioral health centers, about behavioral health urgent care sites, about integrated behavioral health and primary care? We are excited to hear more from you about what you would like us to provide more information on. I still see some responses floating in. We'll give it another moment. It looks like we're pretty static, so I think we can wrap the poll. I want to conclude by thanking you all for joining us today and thanking you, Jocelyn and Stephanie, for your informative presentations. If you have additional questions, I have provided my contact information on this last slide. You can also find the full report on our website. A link to a recording of today's webinar and the webinar slides will be posted on the Foundation website. I want to thank you all for your time and attention and for your interest in this really important subject.